Welcome back, Telemedicine Talk, folks. This is Phoebe and Leo at Telemedicine Talks. You all know us, but I'm super stoked to have this guest here. I'm going to go on a limb, call him a friend when we first met. And yeah, we've been friends for years now and started our telemedicine journey at around the same time. And really, honestly, just an awesome person to talk to, just amazing personality. And I've been trying to get him on this podcast for a while because who doesn't want to listen to him? This is Dr. Okemefuna Okpara, ER doctor, telemedicine doctor, really branching out into a bunch of different things, and that we want to hear more about it. Dude, welcome to the podcast. Finally, thanks for taking your time and being here.
Thank you for that more than generous introduction. It's a pleasure, of course, to be here, and I always enjoy connecting with you, Leo, and Phoebe as well. So thanks for having me.
Yeah, it is great because whenever we talk, we started telemed about the same time, right? And when we were going through and looking things and how to do different things, you always offered your own and maybe sometimes unique kind of approach on how doing things. A lot of telemedicine doctors, especially when we started, were like telemedicine, telemedicine, telemedicine. That was it. That was the end all be all. And the end goal was that. But you figured a way to pick and choose what you wanted, blend your life, and just kind of build on that. Right. Tell me how you approach telemedicine and what your thoughts are. Again, good, bad, ugly. We want to know it.
Sure, sure. Admittedly, I didn't know anything about telemedicine until a few years ago. Whenever, at this point, it's been what, two,
Yeah,
maybe? I
it's
think
around
three.
two, a little
Probably.
plus some change, right? Yeah.
Yes, and I had tried a few things. Now, I'm a full-time board certified emergency room physician, right? And I work in a freestanding ER in Texas, in Austin. Our ERs got bought out by a private equity company in 2021. And at the time, I felt 2021 was dead smack in COVID,
Yep.
or at least 2 years into it, a year and a half. A lot of us are getting burnt out. I'm trying to figure out there's got to be something else to do. And I didn't know what else existed. I didn't know anything about, real estate or entrepreneurs or telemedicine or anything. And at the time I figured, maybe I'll get an executive MBA, and I hate admin work. I don't want to be an admin person. So I didn't know what I was going to do with it. And I wound up taking a value-based medicine course that I did for a year. And then I stumbled onto a telemedicine talk. And I thought to myself, okay, this is different, but this is also still medicine. And I heard it, a lot about it resonated with me because I also have three young kids. Currently, my kids are 3, 5, and 7. And so you can imagine 2 years ago, they were 1, 3, and 5, right? And I'm
Oh,
like, I want to be at home with
right.
them. And I saw that, at least as it was presented, it seemingly offered a way to be able to be at home, not be away, and still hopefully closely mirror, if not make more than what I was making as an ER physician in Texas. Now, some states pay a little bit more than others, so making your ER income may be a little bit more challenging depending on where you practice. So it resonated with me. A lot of the things about it resonated with me. I spoke to my wife and I was like, hey, babe, this thing's going to cost me like, I don't know, 50, 60 grand to get all these licenses. And she goes, you know what, babe, if you think this will work, I'm 100% behind you. She gave me her blessing. I'm like, let's do this.
Super
Get the
understanding wife. That is awesome.
right. And I left some parts out about how some other things that money had been spent on didn't pan out as we had planned it to. I left that part out. So fast forward, I joined this community. We get all the licensing. They help guide us through, and I learn all of the different opportunities that exist out there, whether it's working clinically for a company or whether it's supervising nurse practitioners, remotely PAs, or whether it's becoming a PC owner for a business. And that part is the one that I haven't really delved into that much yet. But it opened up this whole new world of possibilities. And so I think I was one of the first people, like
Yeah.
in my group, to get
Yeah.
to fit
Jumped on
51,
super
right?
fast.
And I started applying to all of the different jobs, and I realized a couple of things fairly early on. And I've spoken to some of the other people that were in my group at the same time, that I didn't love the idea of having to like keep on applying to different gigs.
Mhm. Mhm.
That whole aspect of keep on applying, apply to jobs every week, and it just, I don't know, it just didn't. There's just some things that work for people and some things that don't. I've never been a spreadsheets guy, so when I meet people like, well, keep a spreadsheet. I've made more than enough that I've ever needed, so I don't do spreadsheets, right? And even though, for instance, I don't eat that many carbs now because I'm a pre-diabetic, I don't count macros. They're just some things that I can't do. I know I need to cut out carbs or cut back on carbs because I'm pre-diabetic and I take my metformin. But to sit there and put my food in a plastic container and have it all portioned out for the week, never going to happen. I enjoy the pleasure of doing things a bit too much, and counting macros takes out the pleasure of eating for me. Well, let me bring it back to telemedicine. I just thought of applying to all these gigs. Was the word that's come to mind when I was talking with my mentors was chaos. Like having to constantly apply and onboard. And admittedly, I didn't actually really jump in and apply to as
Yep.
many as I could have. I did a first couple. I don't know if I can say specifically the companies or not, but they were fine. The idea, as I understood it, was also not only are you to apply to a bunch of companies, but even when you're working, work a bunch of different companies simultaneously, just so that you're maximizing or you really being efficient with the time. And so in my mind, it's almost like I have an image of like Minority Report, but it's
Right.
on multiple screens, right? And not gonna lie, that was also a little bit difficult for me. So I bought a second screen. I can pan my laptop and show you my second screen. Never opened. That mouse, that's the
Oh my
keyboard,
gosh.
that's
It's
the
still
screen.
there.
Dude, that thing has been there for 6 months.
Oh my gosh. That is amazing. That is
Listen, the only way Okem knows how to talk is to keep it real. And I was like, okay. So I tried to have a bunch of different things on at the same time on one laptop. And here's the other thing. And when I also started doing some of the gigs that were also supposed to be pretty quick and
Yeah.
turnkey, most of it was in weight loss. I found that maybe because at first I was nervous and I wanted to be sure that I did things correctly and that I was also providing value, I couldn't get myself to just kind of click people through,
Yeah.
right? So I didn't want to work for any companies where, for instance, patients weren't sending in pictures of themselves.
Yeah.
And in doing so, I caught a few people who were full blown anorexic, like skin on bones, right? Or they would send a picture of themselves in a blanket and a hoodie, and I'm like, wait a second, you say you weigh 258. You look like you weigh like a buck 30. I need you to step on a scale. And
Yeah.
I would do this, like I wouldn't.
Yeah.
So it also wound up just not being super efficient. Like something that you could otherwise click through
Right.
in 3 minutes would take me 15.
Yeah.
And on some of these platforms, I was doing a lot of the synchronous calls,
Yeah.
the synchronous weight loss. So I didn't shy away from doing synchronous, and I would call and I would do a little quick spiel. I perfected my spiel on what GLP-1s are and how you're supposed to take them. And all of that stuff took time. And what that meant was if people told me, oh, I can work 3 different gigs and make, $1 million an hour, I was kind of struggling to
Yeah.
make 300 on a good day because I was trying to provide value and do it right.
Yeah.
It's just the way I am. And on some of these platforms where people call in and they want their antibiotic, I'm that guy that's going to be like, well, viruses don't respond to antibiotic. And, you wind up on phone calls with people for the
Oh,
record
absolutely.
that I had my first 2 weeks on one of those things, 23 minutes.
On a telemedicine call.
A 23-minute phone
That's
call for a URI. And the dude hung up the phone on me. And then I continued working and I happened to pick him up again. It was another like 13-minute call. It was just, at that point, I wanted to quit.
right.
So this is all to say that I just found myself, I don't know, not being as productive, found it not being as lucrative as I would have liked. And I'm not going to lie, I started to kind of miss interacting with people too.
Yeah.
Yeah, 'cause I'm a people person.
Absolutely.
Yeah.
So I still do some, a few times meeting with people that would encourage me to just try it, just do it, persist, keep on. I think the most gigs I ever had at a time was 5.
Yeah.
And then, especially with the FDA taking off compounded meds,
Right.
off of the shortage list, As soon as I saw that coming in March, I just stopped because I
Yeah.
didn't even want any kind of liability. I didn't know what was going to be happening. And I'm not going to lie, certainly with the GLP-1 stuff, I haven't touched anything
Yeah.
telemedicine since March.
Yeah.
Coincidentally, I also got a locums gig. I resigned from my full-time ER job locally and started doing locums, paying me about 2.5 per hour, what I was making here in Austin.
Mm.
Yeah.
So I commute, and that 300 an hour, 7,200 in 24 hours, there's no way I can make that work in clinically, at least the way I work in telemedicine.
Yeah. Yeah. No,
Yeah.
absolutely. And to put things in kind of audience context, there's several approaches in doing telemedicine. And the one that you're talking about is, hey, doing several things at once, layering things,
Right,
and also and during the heyday of GLPs too. And I'm
right,
still thinking it's kind of there, but it's kind of fizzling out because of everything that's going on. It was one of the major markets that the telemedicine doctors were in, right?
right,
And to what you're saying, it's right. It's not the kind of medicine that you wanted to do. It didn't fit what you thought, what your definition of medicine was, right?
right,
And it doesn't have to, right? And you found something even better for that paid just as good, better, or that you like doing. You're very much a people person. That's why I love hanging around about you. Guys, if you haven't hung out with Okem, you should, because it's an awesome time no matter where he is. Because he's a people person. People gravitate towards you, and it shows, right? And I could see how that can be a problem. So
yes. The idea of it is still a blessing because I think in my ideal world, I'm maybe working a shift every other fortnight. That's a Game of Thrones thing. A fourth night, that's 2 weeks, right? I didn't know that.
it is, yeah.
Thank you for explaining. I had no idea. I was all,
I didn't know that until Game of Thrones. I learned that from Game of Thrones. It was awesome. Best show ever on TV, by the way. Let me just say that now, coming back to this. So, my dream schedule is to work a shift every other week, okay, clinically, in the brick and mortar. And I'll do that anywhere. I'll travel to do it. I don't really care. And then have some fully passive income from real estate. So I still want to
Mhm.
have some real estate income coming in passively. And I invested heavily in real estate. I've been unlucky and a lot of the stuff isn't paying out as well. And then supervising NPs. I worked in an academic hospital for the first 2 years of my career. I love working with residents. I actually do enjoy working with NPs, but I have to get comfortable with them. So I can't just jump in and start supervising a whole bunch of different random people in different specialties. With the wound care thing, it's all going to be wound care, and we're going to be doing it according to the CMS guidelines of my brother's company. So I feel comfortable in that regard. Plus, he's paying a lot higher than I would be able to, a lot of the gigs that I've seen supervising NPs anyway.
Yeah. Let's
Uh,
rewind. You're talking about this wound care thing. I know
yes.
we talked about this before we started recording, but clue us in, what's going on with this wound care thing? What are we actually
Okay.
talking about?
So essentially, I didn't at the time necessarily have an interest in wound care. It just sort
Yeah.
of happened coincidentally. My brother is a physician in the Southern California area. He owns a mobile wound care company. And he's been in California for 8 years and decided he wants to expand his company nationwide and actually really modernize the practice and incorporate artificial intelligence into the MSO part of his practice.
Yeah.
And so, as he was deciding to expand, he expanded to Texas. He got a Texas license. And it just so happened that I had 51 licenses. So literally, this was all happening at the same time, and so he's like, "Oh, I need to expand to Nevada." He tells me, "Oh, I went to a conference and I met some Jewish guys who own all of the skilled nursing facilities in the state of Nevada and Iowa and New York and New Jersey and down in Florida and all over the place. And we need to open up shop in these states, and I need a physician license to set up the PLLC in each one of those states." And I was like, "Well, guess what, baby brother? Yours truly has licenses in all of these states. And guess what? I'm not even going to charge you for it because my dream is to see my goal, something that I could get behind, is to see my brother's dream of having this large, multi state, national wound care company that does things the right way and maybe has this $300-400 million exit." Okay. So I would happily devote my time to helping make his dream come true. Now, of course, he's also not frugal either, and he's happy to pay me for stuff. But the point is, it's not about money for me either, right? But to supervise nurse practitioners in wound care as an ER doc, I was acutely aware that there was stuff I needed to learn. And so the only way I could do that comfortably, or at least I felt or believed that I could, would be to get a wound care certification, learn at least the basics and do it. Coincidentally, at the same time, because of what I was doing in telemedicine and GLP-1s, I also decided that I wanted to get my obesity medicine certification,
Yep.
which I chickened out of taking last year. So I got the CME, I sent it into the Board of Obesity Medicine. And then the first time I opened the book and I said, Palm C, what? Ghrelin, what? Like, no, I'm going to flunk this test. So I chickened out of taking the obesity medicine exam last October, since it's only offered once a year. And I figured I would focus on the wound care medicine part. And so I've been doing that for the last 6 months or so, just
Oh,
taking
wow.
courses,
Yeah.
studying. And I took the exam yesterday and I passed the exam. So like now, right, yes, I'm like, okay, I'm ready. Bring the nurse practitioners, start paying your boy the money, right? And so that's where the wound care came in. And of course, because what I learned in the telemedicine community was also nurse practitioner supervision, and I had actually started doing it on a small scale, that concept, it also falls in and aligns with one of the revenue generating
Yeah.
strategies in telemedicine. So it's a perfect marriage of what I was doing in telemedicine with what my brother is doing. And it's seemingly working out perfectly.
You're making a great point though. When we first started talking with you, you were talking about one pathway to approach telemedicine was a straight up clinical pathway, right? You turn
Right.
and burn, you see patients, and you get paid for seeing patients, right? Now you're talking about, and we know you don't like admin, so that part is another stream. But now you're talking about going into wound care and now supervision. And you admittedly said, hey, I wasn't very comfortable doing so with other things like, obesity medicine, but now wound care medicine, where you got your certification. Now you're ready.
Right.
What was that change? Was it because now you've gained education yourself and now you feel comfortable guiding people on how to do that or taking report on how to do that? Because yeah, you're right. This is right up kind of one alley that people take and is very successful in this.
Right.
But getting over that barrier, right? There was a lot of barriers. You were trying different doors and you were hitting barriers, but this one seems to be working out for you. What difference between this route with wound care versus all the other kind of barriers that you've run into?
It's one of those things where I feel like you have to, unless some people believe that they know exactly what they want, right? There are some people who do, I want to become an orthopedist even when they're in college. So they apply to medical school, right? They start doing their classes and they're like, I'm going to go into an orthopedic. And then they get into the residency, or God help some people, they graduated orthopedics and like, oh my gosh, this is not what I thought it was going to be. And then they want to switch and do something else. When I got into med school, I had no idea what I wanted to do. And I just started doing my different rotations. And I stumbled upon emergency medicine and I was just like, this is it. This is me, right? Similar concept here where I didn't know what I didn't know. So I didn't know what would work for me or what wouldn't work for me until I started doing it. And again, a lot of things that caused the working on the different company, and I was not at ease. I may not have come across that way whenever you guys saw me, but it was too chaotic and it seemed too forced. And I just felt like I wasn't going to be able to make the kind of money that I want. Because to be clear, this is all a means to an end for me.
Yep.
There's nothing about telemedicine or wound care or even emergency medicine at this point that I can say that I absolutely love. What I love is the concept of being around my young kids while they still want me to be around them. And anything that is going to allow me the ability to be present with them, I am happy to do it, or at least give it a shot. So I just found that I was almost like trying to force myself, forcing a square peg into a round
Mhm,
hole
mhm.
with the clinical stuff. With the supervision stuff, I started supervising 2 NPs in Houston, internal medicine. Okay, whatever. Like I'm an ER
Yep.
doc, but whatever. That's still my bread and butter. And that once I started doing that and going over their notes, doing my monthly meetings, I was like, okay, I mean, whatever. This is like teaching residents, I guess, but not exactly. So I very quickly got over any sort of discomfort with supervision of NPs. They're still at baseline, still a little bit, because again, you still don't know how well the people practice. But with wound care, a huge part of it is feeling like I actually have the knowledge, so I'm not an imposter anymore. That's definitely a huge part of it. But the other part of it is that from a risk standpoint, as Phoebe mentioned before we started, I do believe there's not zero liability, but I believe that you just have so much time to course correct. If something is not being done right, you have time, whether it's blood sugar that needs to be optimized or whether it needs to be the correct dressing or what, the likelihood that you can do something on one visit to screw a patient is really low. And as long as the company that you're working with adheres to the CMS guidelines, which fortunately my brother's company does, I feel like the liability and the concerns there are low enough that it doesn't make me lose any sleep at night to do. So I feel like I just didn't know that beforehand. You try one thing, didn't quite work. I actually dipped my toe a little bit with the PC owner thing, and I still don't fully understand what my role in that situation was going to be. And that's something that I've texted you about a few times that I want to really understand what
Yeah.
that means. Like when I'm a PC owner, like, what does that mean? One of the words that I hate the most is the term consultant. And no offense, Phoebe, I know that you kind of. I'm just
I
saying,
am
what is
offended.
because I consult, like, what does that actually mean? Like, what are people paying you to do? Because it's such a nebulous, obscure, not concrete enough in my mind, right? So the PC owner thing, I don't fully understand it. Supervising NPs, I know specifically what that is. I know how to do it. I know what's good medicine. I know what's not good medicine. And it just seems like it's just the most natural progression for me. And as it turns out, it's with a company run by somebody who I trust in my brother. And it just worked out perfectly.
Yeah. I'll jump in.
Yeah.
I think there's a lot of confusion on like what the PC ownership role is. And I think that is because it varies what the requirements are by contract. But
Sure.
to your point, and like I'm not going to go down, I could totally go down the PC owner rabbit hole. But, to your point, I think the biggest thing is like you're working with somebody where you have the ability to trust that person and you have
Right.
the ability
Yes.
to, one of the things I tell all the physicians and even like the different practitioners that I've worked with is like you're having to like build this interesting relationship with a person virtually who you
Right.
need for compliance reasons. You don't want to even work with this person if you didn't have to. Like physicians love it because they get money.
Right.
Nurses and PAs hate it because they feel like it strips them of autonomy. And I'm
Right.
like, well, like it's the relationship piece, right? Like it's the when shit hits the fan, you have a doctor you can call who could explain to
Right.
you why you put that skin graft on incorrectly or
Right.
whatnot. But to your point, it takes you some time also to go, like how is their patient care and
Yeah.
how are you actually doing things? And I think
Absolutely.
that's where it's that one thing where it's uncomfortable at the beginning, but it
Mm-hmm.
takes time to get there. But once the
Right.
trust is there, you're going to have some really cool wound care has been my new thing, by the
Oh,
way. I'm working on a
okay.
big wound care project. So it's wound care. I'm getting real up on wound care.
Okay.
But I think that you're going to have a really great opportunity with your brother and you're going to be able to go so much further because that trust is already there.
Yeah. No, and great points. Great points. Because it's very interesting where you could have just in the beginning just said, hey, I'm going to go all out. I'm going to say yes to everything, even if you're uncomfortable. Right. And it takes, I think, a lot of courage, a lot of mental and moral fortitude to say, no, I'm not comfortable doing this, even if the potential income is there. Right. Because we see, and we've heard of all these, a lot of stories where that's when people get into trouble, right? They don't know what they don't know, but they're still going to do it, right? Or they just gloss over that fact, or they're just going to accept maybe a relationship where it's uncomfortable and they don't trust it, but they're just going to accept it anyways
Right.
because the
Yeah.
potential payout is there. And that's when we see people just falling into hot water, right? Getting into trouble,
Right.
regulatory wise, medical legal wise, things like
Right.
that. And, I think it's a testament to doing it right. You found a situation where, hey, I trust this person, right? And
Right.
who best than siblings and maybe some siblings there once. Definitely
Yeah.
right. You trust this person that is
Absolutely.
using you and your name and your license and your reputation,
Right.
and you educated yourself, right? You got this licensing, and now you feel, and you probably were, but even better now that you've got the certification, you feel not like an imposter, right? So,
Correct.
and giving yourself that ability and education to do so is key. And no, this is awesome. This is awesome to hear, because this is I've known you for a while, and you've been chipping away at different things, and you've been so
Yeah.
frustrated. And it's
Yeah.
awesome to hear your excitement now. You're actually very excited about this, into this new journey, which is awesome.
If it wasn't for the Botox, you would see my face going all the way. I'm just kidding. No, I am excited. And the thing is, I am wired to do things the right way. I'm not trying to toot my own horn. For instance,
Yeah.
when I was working on some of these GLP companies, people that I knew that also worked on the companies, and then they'd stop working in those companies, and some of their patients would flow over to me, right? And I would see people on GLPs who had asked questions that were never responded to, or who were at the same GLP dose that they had been on for 4 months. And there was never any discussion about, like, hey, is it working for you? You may think you need to lose 10 pounds in a week, but the goal should actually be a kind of
2 to 3,
steady half pound to pound per week, maybe 4 to 6 or 8 pounds per month, depending on what you're starting off at. So this is someone who is sort of a voice in the telemedicine community, right? And I'd be getting patients that they'd been seeing who had no interactions with the physician at all. And I'm just like, I can't practice medicine
Yeah.
that way. And so I caught myself, like, whenever I would get to those, I would have to call them, and because I just can't, if I'm not going to do it right, you're not going to see me doing it
Yeah.
at all. That's just the way I am. And it's okay. And at some point, I may still go back and do it. But the point is, doing it the right way wound up taking a lot longer. And as a result, wound up making it, the pure clinical part, not as lucrative as I would have liked. And then the other thing, too, again, for me, chaos is something that's like my kryptonite. And so when in my mind, I envision 3 screens, like one screen here, one screen here, it's like, okay, like in 5 seconds, in the 3 minutes, okay, maybe you can kind of jump here and layer and do that. And I just like see an atom kind of darting and jumping around. I can't do it. This is not me. And I spoke with some people who felt the same way, but they never really voiced it as much
Yeah.
because it seemed like everyone else was figuring it out, right? And everyone else was doing it. And then you talk to people and you're like, oh, well, actually, not everybody has figured it out and has mastered layering and doing all of that stuff. And I had conversations with 3 or 4 people in my cohort and in my community. They were saying the same things. Now, the difference between me and them is that they were not ER docs. So unfortunately for them, they were a little bit more pigeonholed into what else they could do. But I was like, listen, you don't have to feel bad about the fact that you tried telemedicine and somehow it turned out not to work for you. If you wind up having to not renew your licenses and you wind up going back to working, whatever, I think one of them was a radiologist.
Yeah.
And so be it. Like, who cares? And they actually had a really good gig. I think they were radiologists, and they worked 2 days a week. And they also found it a bit too chaotic being tied to their laptop. The 1 month where I made the most money in telemedicine, I was on my laptop for like, I don't know, it felt like 10 hours a day. I was at home,
It can
but
be,
I wasn't.
yeah.
I was at home, but I wasn't present. My kids would try to come into the office and talk to me. I'm like, no, and then your Slack is going off on your phone. It was all too much. It was not for me. So at least the chaos was not for me. I'm not saying there's any one thing about it that is bad or is negative. It just, taken all together, it didn't work for your boy, the Oak Man. I refer to myself in the third person.
Love it.
I think one thing, like, just to and again, like this is me coming from like my weird compliance background. Like I think one of the things, I met you, Okem, like last October. And I think one of the things that you spoke to my heart when Leo knows this. I think everybody knows this. I am not the biggest fan of the GLP-1 industry, the way that it is prescribed in mass, right? I think that there's tons of people that it benefits, but I think that you need to make sure that people aren't abusing it and they are the right weight. Like I have had friends that have had it prescribed to them, and I'm like, how did you get a prescription? You weigh 105 pounds. Like what?
Maybe that's
What
3
is
foot nothing. What do you know?
well, that's my whole thing. But you have a conversation with Okim, and he was the doctor that was like, I don't care if it takes me 23 minutes to make sure like this person is, like they're stepping on a scale and their ID matches their weight. And I just wanted to say, like, I really, really, really respect the way that you have treated that industry, because a lot of doctors don't do the due diligence that you had done.
Well, really the approach in general, right? You stuck to your guns, you stuck to your moral fortitude and said, hey, this is the kind of person and the kind of physician I am. And this is the way I'm going to practice medicine. I'm not going to have anybody tell me otherwise. And, just because people are seeing success in one kind of avenue doesn't mean that's going to be for you. Right. And when you say, hey, you're not realizing kind of the returns as quickly as you thought. You started this, what, a year and a half ago, 2 years ago?
I don't think it's actually been
right.
It hasn't been 2 years.
What kind of market really do you see returns like that other than hitting the lottery and whatnot? Right. Like relatively, you're still on point. All luck to you in this new venture, which it's sounding like it's what you were hoping to realize, maybe a year ago, but still, it hasn't been that long, to be honest, right? And now you're doing it your way, right? You are not compromising your kind of moral foundation and just who you are as a doctor to do so, which is freaking amazing, I think. And I wanted to get you on and so people could listen to this and realize that, hey, yeah, there's different ways to do things here in this market. It's just not the one way that the majority of people are doing, or even there's different kind of methods, different approaches, different ways. And I'm super stoked that you're able to find one that fits and that you're happy with.
Right. I have told people at my job about telemedicine. So it's not like I'm saying, oh, God, is this thing you should avoid it? No, I've actually told a few people at work who know nothing about it. And one of them has actually started doing some telemedicine, not on the scale at which we're doing because they're not like a part of the community. But if it wasn't for even exploring it, I wouldn't have met the likes of Phoebe. And I love knowing the likes of people like Phoebe who are authorities on a certain, especially with compliance, because for me, doing things the right way is the only way to do things. And I am acutely aware that I don't know what I don't know about so many of these different specialties. And so if I can have someone say, hey, okay, this is the way that, this needs to be done. And I can focus on practicing the medicine, right? And then have somebody tell me otherwise how everything else is supposed to be done. It's like a perfect marriage of the expertise. So had it not been for this community, I wouldn't have met I wouldn't have met you, Leah. I wouldn't have met you, Phoebe. There's also a mindset thing where, when you're used to just doing one thing, you kind of have this fear of the unknown. And the fear of the unknown never goes away. But the more you try different things, unknown things, the less scary doing something unknown starts to feel eventually, right? So that now the concept of doing something that is completely foreign to me is, again, I'm not suggesting it's going to be easy, but it certainly is not as intimidating anymore because there have been several things that I have literally started from scratch. I started the whole telemedicine thing from scratch. I started the wound care thing from scratch, right? And so at this point, I just feel like the sky is the limit as far as opportunities and what I can pivot to doing. And I'm excited, man, because I feel like, I don't know what the future holds.
I'm excited for you because, we've talked a lot of telemedicine stuff, and this is the most excited I've seen you talk about this. So this is I like seeing this part of you.
Yeah. I feel good, man. I also feel particularly great because I passed the damn test.
Hey, there it is.
There's that
That's
part
awesome.
too.
Yeah.
Yeah. So, right now I just know that I'm paying my bills, working my brick and mortar gig. I'm going to slowly tack onto that with my brother's company. It's going to be a gradual thing.
Yeah.
I'm going to do it right. I'm going to go over their EMR. And then once I start to augment my income with that, then I can cut back from my brick and mortar.
Yeah.
And then I'll just let go with the flow and do what comes naturally. I'm not going to force myself to do things that don't come naturally to me. I'm not going to force myself to count macros.
Yeah,
I'm not
as you
going to force
shouldn't.
myself to do spreadsheets. I'm not going to force myself to work multiple telemedicine gigs.
Mm.
They're just some things that I'm just not going to do because it just doesn't, I don't know.
No,
It's a
it's
Virgo
amazing.
thing. It'll work for
You know
me.
what? I think that the telemedicine was probably the tip of the iceberg that just showed you that, like, you're not stuck in the ER. So it's like you jumped into that and like it was like, okay, well, maybe that wasn't for you, but like, look, now you're like really,
Yes.
I don't ever want to supervise an NP to like, now that's like your jam and you're doing locums. Like,
That may have come out of your
I look
mouth
at
at
it
one
from a,
point in time.
Did I say that? I don't know if I said that.
Yeah.
Are you
you
guys
said it.
sure?
You said it. No, well, I think
Mm,
again, it just goes back to like you have worked very hard for your licenses, and I say this to
Absolutely.
every
right.
single doctor that I
Right.
like
You
work
did.
with. Right? You all have worked so hard for these licenses, and like you're really gonna give that up to supervise an NP for $800 a month, who
Right.
You can't trust, right? And you
could
don't
or
know what you
couldn't
don't
like
know, right?
yeah,
Yeah.
Mhm,
yeah. But again, I
mhm.
think this whole thing just showed like you're able to pivot and figure out what works for you. And I think that's the beauty of like the traditional identity of a physician used to be you're in an emergency room or you're, doing surgery or whatever the hell you doctors do. But like, um, I'm just gonna channel the pit and but I think that's cool. I think that's really cool that you were able to just like give it a shot, go, I did it and I wasn't crazy about it, but like
Mhm,
yeah, like maybe like
mhm.
locums is the thing. Who knows, It's
Right.
cool.
And I also got to thank you, Phoebe, because you also, I mean, I would have felt and done what I was going to do anyway, but it's always helpful to have somebody corroborate your point of view from a different point of view, right? And you made that comment that, no one should, something about protecting your license as hard as you do, or something to that effect. And I was like, okay, I guess I'm not nuts because again, I just saw people, and I wouldn't say that anybody was reckless or careless. That's not what I'm saying. But what I am saying is, I just kind of saw a lot of people seemingly not put in the amount of time or create as much value for the patients as I felt that they should. And the other thing too, all these people are getting these GLPs from so many different sources, right? And so, like, it's just like the wild, wild west out there, and people are just, and I was just like, wait, what the hell is going on? So when I spoke with you there, Phoebe, there were a lot of things that you said that sort of made me be like, okay, yes, I know I'm not crazy. And even if I am, well, so be it. I'll just be crazy, I guess. But it was nice to actually have you say things that make confirmed sort of how I should feel about protecting my license or
Yeah.
whatever else.
Yeah.
So yeah, man. Well, sky's the limit, man. Sky's the limit.
Well, I
That's
wouldn't be
exciting.
surprised if we have CEO Okem running admin stuff or project manager Okem.
That's
Since we're breaking down barriers here,
He's
hilarious.
spreadsheeting. He
right?
comes back,
Get
he's a
tables. I don't
spreadsheet
even know the
wizard.
hell that is.
That's
So,
hilarious. I don't know that I ever said I would. Are you sure? Are you guys sure that I said that I would never supervise an MP?
No, you didn't.
maybe
I don't
not
think you said
never,
never, but I
but
think it was again, I think what came through was like you were not comfortable with
yeah,
it because you trusted yourself.
it was a
And I think what's
lot
so
of
funny is
hesitancy there.
at the
Yeah.
beginning of this, I think you said that too. You were like, "I trust myself, like, I don't trust,
Yeah.
like, no other person." But I think that's what came across. Like, you're like, "I
Sure.
trust
I think
me."
that's right. I recall that.
Hey, it's
I
okay.
got
You're
it.
coming around. You're turning a new leaf.
I
Well,
recall that.
well, hey, we're getting to time. Phoebe, this is my new last question. I've done it a couple of times. So, closing thoughts, but the last question I like to ask is, hey, looking back in your career and looking back what you learn now and what we've been talking about, you know, approaching your intern self. This is July 1st of intern year. I'm not going to ask you to repeat the date. That's going to date you. What would you
Mhm,
tell your
mhm.
intern self on day one? Knowing that what you've learned about anything, everything, all the above.
What would I tell my intern self? Man. See, oh my God, my intern year, I was so nervous. I was so nervous about like actually, of course, we still had attendings, but I was so nervous of being the one that had to go take the history and
Yeah,
and,
right.
and actually practice the medicine. And attending when I was an intern, and it's been so long now, it was over 20 years, but I don't remember specifically what they told me, but it was something along the lines of, you know what, because I felt like I was slower than everybody else. I wasn't as smart. Like, I don't know. And he was like, you know what, okay, you're going to be fine. And he basically encouraged me. I don't remember specifically what he said. Well, fast forward to now, I would want, and again, this is not tooting my own horn. I would want someone who approaches medicine the way I do, treating my family members and not necessarily the smartest person in the class. So, what I would tell myself as an intern, because the way I felt as an intern is the same way I felt when I first started doing the telemedicine and seeing a lot of people crushing it, where I was just like, am I dumb or what? Is, you know what? Do you do it right? And learn what you need to learn and practice medicine the right way to practice medicine. And ultimately, it all works out. I mean, that's really kind of what it boils down to, right? And the other thing that I would tell myself as an intern, of course, when I was an intern, I thought I was only going to be doing emergency medicine. Well, now I know a lot better. And
Yeah.
I know that there are several different options and there's several different roads that you can wind up going. And I would tell myself that I wouldn't necessarily pigeon myself into one thing. I wanted to be an ER doc at the time, so that was all that was on my mind. I knew that I didn't want to be working full time by the age of 50. I'm 48 this year. So in 2 years, I think I'll be able to achieve that goal. I would have told myself, just do you, practice medicine right. And, you know, there are so many different opportunities that exist or that are out there for doctors who practice good medicine. It doesn't have to be just clinical, it can be in a supervising role, it could be in an admin or consulting role. Of course, it could be in a clinical role, just, calling out my consultants out there. You know what I'm saying? Um,
We do some
Right.
good work. If you find a good consultant, we
I
get
100% agree. I completely agree. So I'd say, just the sky's the limit. There's just so much you can do. And the jitters are normal, but you stick with it, you do it the right way, you get good at it. We're smart enough. We got through med school. You're smart enough, you're gonna figure it out.
Yeah.
And I would always tell myself, don't ever try to force or shove something down your throat that's not working for you. That's not fitting.
I
No,
love that.
thanks for being a testament to that as well. No, it's
Absolutely.
awesome. Hey,
Change course.
dude, thank you so much for your time. Honestly, it's always a pleasure talking to you. And even if it's virtual seeing you, it's always better in person. So hopefully we find a way to hang out again. Yeah, no, absolutely. But yeah, no, thank you again. And Phoebe, any closing thoughts? Okay, any closing thoughts?
No, well, I mean, I'm super glad we got to do this because
Yeah.
I'm going to Nigeria on Monday. I'm going to be gone for like a month. And that's the beauty of doing locums, right? And like, I'm going to shut down my laptop and do nothing while I'm there. So being able to do locums and do telemedicine if I wanted to, which I'm not going to do, is only possible
Yeah.
because I quit my directorship role, something that I've been doing for 12 years.
Yeah.
And so when initially that first date that we had set up wound up not working because the schedule got changed,
Yeah.
I was super bummed when I thought we were going to have to move this all the way till we got back from Nigeria in September.
No, thanks for sneaking
But
us in your schedule, man. This is great.
It worked out because I actually couldn't make the other one either, Okim. I was on a plane.
oh
So
yeah, you said that.
Yeah. So
yeah,
you would have been
I
stuck
was
with
like
little old
four
me.
cocktails deep when I was talking to you guys.
No, I love Leo, of course, but Phoebe completes Leo.
Oh, thanks. Awesome. Well, hey,
Yes.
Telemedicine Talks, thank you so much. And we'll catch you later. Aloha.
Thank you. Bye.